tonight by our City of Berkeley Health Officer, Dr. Lisa Hernandez, City Manager Dee Williams-Ridley, and the Director of the Department of Health, Housing, and Community Services, Dr. Lisa Varhus. Before I go to Dr. Hernandez for an update on the number of cases in Berkeley and in the county and the state and updates on recent health orders, I just want to provide some introductory comments. It's with a great amount of pride that we in the city of Berkeley celebrate the election of our new Vice President, Kamala Harris, who, as we know, grew up in Berkeley and attended Thousand Oaks Elementary School. And Vice President-elect Harris is a daughter of Berkeley, and her experience growing up in Berkeley in the 60s and 70s during a time of great social change, not just in our country, but in Berkeley, had a formative experience on her. And we do believe that her experience as somebody who grew up in Berkeley and rooted in our community's values will help our country address critical challenges such as our COVID pandemic. And we already know that the Biden-Harris administration is already working to develop a federal plan to address the COVID-19 pandemic. Just today, they announced the creation of a task force to guide the new administration's response to this public health crisis. And so we're encouraged by steps already being taken by the new administration, and we hope that with a comprehensive plan and new resources that Berkeley and California and states throughout the country can work to control the spread of this deadly virus. So a little bit about what we're seeing, an increase in cases, not just nationally, but here in the state of California. We are seeing an increase in cases and positivity rates nationwide. And in California, the governor announced today that the new 7-day average is 5,889 cases. And the positivity rate in the state went up from 2.5% in mid-October to 3.7%. So that is a very troubling increase. And in the city of Berkeley, our positivity rate is at 1.06%. So we are concerned about the increasing positivity rate because that really is an indicator of the increase of cases. And we know that we're facing a potential twindemic of flu season as well as the threat of COVID-19. And great work has been underway by our public health staff to increase access to flu vaccinations for vulnerable populations. But we encourage everyone to get vaccinated, your flu vaccination if you have not already, so that everyone is vaccinated and prepared for the approach of flu season. And as we're entering the 8th month of our shelter-in-place order, despite the fact that throughout this entire pandemic, Berkeley's done a very good job of managing the spread of COVID-19. We are not over yet. We are expecting a very dark winter with the combined threat of influenza and COVID-19. We are seeing an increase in cases. And so the steps that we have been taking, we must continue to shelter in place, to follow the public health orders around facial coverings, to wear facial coverings when you're outside, to limit your interaction to pods of, I think, no more than 15 people over a several week period, and to practice physical distancing. All these are critical to help control the spread of this virus and to make sure that our community can get through this over the next few months, as a vaccine will be becoming available hopefully sometime early next year. So thank you to the people of Berkeley for doing your part, and we must continue to be vigilant. So thank you. So with that, I'd like to now turn the floor over to our City of Berkeley Health Officer, Dr. Lisa Hernandez. And Dr. Hernandez, good evening. And if you can provide us an update on the number of cases in Berkeley and any modifications to our public health orders and any other information you'd like to share with the Berkeley community.
Sure. Good evening, everyone. I'll start with Alameda County numbers first, and then focus in on City of Berkeley cases and our percent positive and some of the data that is specifically focused to the city. For Alameda County, we're now at 24,027 confirmed cases with 466 deaths. For City of Berkeley, we're now at 842 confirmed cases. That's an increase of 103 cases from our last report when we were here in the latter part of October when we had our last town hall. And what we're seeing is an average daily case number. Like every day we see about 7 cases a day. Back when I reported last, we were seeing about 3 cases, 2 to 3 cases a day. So we're definitely seeing an increase in our daily number of cases. And I'll talk about the case rate in a minute. In terms of deaths, fortunately, we remain at 9 deaths. That's not a change. Though when we start seeing number of cases and we see increases in hospitalizations, then what follows oftentimes is people succumbing to COVID and passing away. So I'm hoping that that number does not change, but we are seeing our case rate change. And when we're looking at Alameda County hospitalization data, we are seeing hospitalization data increase as well. So I'm hopeful, but worried and concerned about what our impact of the severity of the disease will be on our community. When we look at our total tests reported on City of Berkeley residents, we're now at 88,607 cases, tests reported total. We're averaging about a 1,000 tests per day, which is excellent. So we are more than adequately testing our community, which is important, and our percent positive rate is at 1.1%. So I round up a little bit, but it goes to 1.1% for our percent positive. And that's a little lower than the last report, but still not in a bad place. But as the mayor has mentioned, that percent positivity is rising in other parts of our state and our region. What we're also watching is our case rate. We had a low case rate, actually below 1 case per 100,000 per day back in mid-October, and now we're at 4.2 cases per 100,000 per day. So that's very worrisome when we're looking at our case rate. I'll talk a little bit more about where we are with our blueprint for safe reopening, the state tiered status in a minute, but I just wanted to talk a little bit about what we're seeing in our cases. We saw about 23 cases actually this weekend, and we're starting to do a deep dive in those cases to see if there's any particular types of exposures that we're seeing that we need to focus in on when we're looking at our efforts. What we are seeing is very similar to what we've talked about already, is that it seems like it's households that are transmitting it. You know, one person has it and maybe transmitted it to each other. And we're also seeing some outbreaks in some settings, but that's not contributing to the change, total change in what we're looking at our case rates. So we are still continuing to watch that individually here in the city of Berkeley. As a county and as a region, we are talking as local health officials to see what our colleagues are seeing and what we're seeing across the Bay Area. And we are seeing a rise in the, as the mayor mentioned, the case rate and percent positive. So we're looking to see if there's any particular activities that are contributing to that rise. What we worry about is that the higher risk activities are definitely not helping with this rise, which means being indoors with your face covering off. So those are things that, you know, if someone asked me, what could I do to be safer? It's keeping that face covering on when you're indoors, when you're outside of your household. So those are the things that we're seeing in terms of our cases. I think Dr. Varhus will talk a little bit about our testing. So maybe I'll hand it over to Dr. Varhus first, and then I'll come back to the tier update, and then a little bit about travel and holiday guidance.
With regards to testing, I think it's worth noting that the city of Berkeley is supporting 2 primary test sites for the general public. And you can sign up for appointments for those tests on the city's website. One of them is Optum Health, which is actually run by the state of California, but supported and coordinated by City of Berkeley staff. And the other one is Curative, which is an independent testing organization that bills insurance for testing. There have been a number of some questions have come up lately around the curatives test availability. Generally speaking, they are extremely reliable. You can often get a test, sign up for a test and get it the next day. They will often take walk-ups when they can accommodate them. And then that level of accommodation sometimes bleeds into a capacity issue when people begin to expect that they can get a test if they walk up, and then certain days they cannot. So they're a new organization and they're still working out their kinks. It's not perfect, but generally speaking, people who have been tested there have been extremely satisfied with both the methodology, the kindness, and also the quickness of results. I also would recommend the Optum test site, who have also both improved their methodology. They have longer opening hours from 8 a.m. to 8 p.m. Every day, Monday through Friday. And they are also becoming quicker at turnaround times.
So I'll talk about the blueprint tier, and then we can talk a little bit about school. So currently, Alameda County continues to be in the orange tier, which is tier 3. However, and we remain at that tier. The results of our case rate and our test positivity will be released tomorrow. In terms of where we are landing for the next assessment for the week. I don't anticipate being in a more or a less restrictive tier. I believe we'll stay in the moderate orange tier. However, what you see with the activities that we're allowing in Alameda County and City of Berkeley is that we're largely keeping to the red tier activities because we're opening slower than what the state allows. And as you see, even with those changes, we are that slow pace, we are seeing an increase of cases. And we're watching that closely to see how that impacts our overall health. What we have allowed, that is a change effective today, was allowing middle schools and high schools to open if they choose to, and they have to adhere to the same criteria that the TK through 5th grade schools had to adhere to, which was having a site-specific plan that is based on the industry guidance from the state and the Office of Education. Things that are a little different, same as for TK to 5th grade, is that they need to have 2 COVID liaisons. They need to have a testing for their staff. So all adults have to be tested every month. They also will get a site visit from the City of Berkeley team. Once they're in operation, they do have to post their plan on their website and have make sure that their community is aware of the plan and that they've had communication with them. So that's the only difference in our plan or our order that we released last week and became effective today. We continue to work with middle schools, with the schools, to make sure that they have the support they need. We've done COVID liaison trainings. We have a book for them that they use. It's like a handbook. And there's 6 series of sessions that we have with the COVID liaisons. And that's been well attended and well received, to the point that childcare also was interested in having that same level of training. So that's going to happen in the middle of November in terms of that training. Other thing I want to talk about is holiday travel. We're already in November. Some of us are already planning our menus for the holidays and excited about seeing their families. Basically, the Bay Area health officers, we released guidance today to provide some information about how families could could safely celebrate the holidays with their loved ones. Of course, the safest gathering is one with your household only. However, we know that during the holidays, you may want to have additional mixing of family members. So there's essentially like a rule of 4 S's, I call it, to help you when you gather in person. Keep it safe, small, short, and stable. I think those are 4, yes, 4 S's. And what that means is safe. Safe means outside, physically distanced, wearing face coverings on, keeping them on, and removing them only when you're eating or drinking, and putting them back on as soon as you finish you're putting your fork to your mouth. Small means limiting your gatherings to no more than 3 households. Short means limiting your gatherings to no more than 2 hours. And stable means do not participate in multiple gatherings with many different households. So let's say you have multiple gatherings during the holiday. You have something on Wednesday, Thursday, and Friday. Try not to mix those households. Make it those 3 households for those 3 days. Maybe you have it at different houses in different backyards, but that you're not mixing with people. So those are the 4 S's for keeping your gatherings safer. The other thing is about travel. Basically, non-essential travel during the holidays is not recommended. We also recommend that if you do travel outside of the Bay Area, that you consider self-quarantining yourself for 14 days after you return from those activities if you participate in activities that put you at higher risk. And what does that mean? That means spending time within 6 feet of people who you do not normally live with, or you're not normally around, and you're not wearing your face covering, especially if you're indoors. The second higher risk activity includes traveling in planes, buses, trains, public transportation, or other shared vehicles, especially when face masks are not worn at all times by yourself and all those people in the area, especially in a vehicle. So that's the guidance that was released. I believe it's going to be posted, if it's not already posted, on our webpage for individuals to look at and to help guide their travel plans if they have any, or their gathering plans for the holidays. And I'll stop there and hand it back to, I don't know if Dr. Barhus has other comments she wanted to add. Otherwise, I'm done with my presentation.
Dr. Barhus, any other comments you'd like to offer at this time?
I'll hand it back to you, Mayor. I know there's some questions that still need to be answered, but I'll yield to your facilitation.
Okay, thank you so much. Now I'd like to turn the floor over to our City Manager, Dee Williams-Ridley, and thank you for joining us this evening, Madam City Manager. And if you could provide us an update on city operations and the city administration's response to COVID-19.
Thank you, Mr. Mayor. And before I get started, I do have 2 areas I want to cover this evening. But before I do that, I'd like to just first give you a virtual salute and congratulations on your reelection to our city. Under your leadership, we have done a tremendous amount of wonderful things for the city of Berkeley community. And so I'm very, very proud to serve under your leadership, and I'm proud to serve the Berkeley community with you. So congratulations and thank you. Thank you for your service. You have a tough job. I don't know if, I'm sure people tell you all the time, but you have a tough job. So thank you for enduring and taking on that challenge once again. So tonight, what I'd like to do is just kind of update folks on our most recent presentation shared at the October 27th council meeting. It is now available on the city's YouTube channel. So I want to just share a little bit about that. I'm not going to go into a huge amount of detail, but to make we've created a 4-part playlist, and it breaks this 90-minute presentation that we provided the council into shorter videos. And we've covered them in 4 areas. Number 1 is Berkeley Ready. This basically covers how the city responds to emergencies. It describes the planning and the training over many years that enable us to respond so rapidly and nimbly to the pandemic. Part 2 of our playlist is Berkeley Safer at Home. This basically highlights the incredible work of our Emergency Operations Center. It focuses on work across 5 very distinct themes: COVID testing, work with vulnerable populations, public information, business and art support, and cost recovery. The latter will be one of the most important steps that we take as an organization, is finding a way to get recovery for all of the costs that we can possibly recover for our city moving forward. So I've taken that very seriously as a city manager, and we will be looking to pull in every dollar and penny that we possibly can for recovery. Part 3 of our playlist is Berkeley at Work. And this is showcasing how our organization as a whole, how we've adapted to the pandemic, the shining light on the ways staff across the city took on very, very new responsibilities. They shifted services online, adapted in resourceful and creative ways, just to continue providing really good service to our community in what we call this new reality of COVID. Part 4, and the last part of our playlist, is Berkeley Resilient. This looks forward to how we will build back better once the pandemic is over. We believe that as we move through all of this, we need to be planning right now about how do we be more resilient and be prepared to address what we look like after COVID's over. So we'll be talking in that playlist, it discusses the city's resilience strategy. I'm really, and very quickly, I'm very, very proud of the work that our community, our council and the mayor and our staff have provided to support and protect our community in this very unprecedented time. And we encourage all of you to go on to our city's YouTube channel and share these videos with folks so that they know exactly how well and how much your city is doing to support and keep our community safe. The last thing I want to focus on, Mr. Mayor, is our response to the unhoused population. And I certainly like to provide this kind of data every time we speak, because this has truly been one of the hallmark pieces to our response to COVID. So a core part of our work has been to find shelter for those people who are unhoused and who are medically vulnerable. That has been an intentional push, is to look for those folks that are vulnerable. As you know, the 4 units that are housed on 5th Street, those are fully occupied as of today. In addition, 10 of the 18 trailers we established are currently occupied by 13 people. And then both of the county-run hotels, they continue to be used extensively, and most are Berkeley residents. So this is a reflection of our outreach work. 66 of the 69 rooms are currently occupied at this time. We also continue to see the active use of our expanded shower program. Willard saw a total of 358 clients, or an average of 28 of them a day. And of those, and we break it down by men and women, that's not so important in this regard, but it lets the community know that it is very diverse in terms of the women and men that are utilizing our expanded shower program. And then the West Campus shower program also served a total of 299 clients. And that was an average of 21 per day. So again, our focus has been on those things that matter most to our community, those clear, critical needs that people need, just the basic human needs that people need in our community. And then lastly, for our unhoused, we've been doing a lot of work behind the scenes with both the mayor and Senator Nancy Skinner in looking at ways to truly address our unhoused community that are on the I-80 corridor. So a lot of work is going on behind the scenes. We anticipate within the near future that we will have an outdoor shelter lifted up in our city so that we can bring people out of those areas, especially on off-ramps, areas that are just directly in our downtown area in our cities, so that we can pull people into a respite shelter area, into what we call pallet shelters, which looks similar to a tough shed. And so that will allow people to actually have warmth inside of a tough shed and not be in a material type of a tent. So we're looking for this to occur in the very, very near future because the weather changes are occurring for our unhoused community. So a lot of work behind the scenes. Thank you, Mayor, for your leadership on that, and a lot of work with Caltrans. We're hoping to hold them to the carpet. A lot of work as we move forward, but we are continuing that effort. So with that, I'll turn it back over to you, Mr. Mayor. Thank you.
Thank you very much, Madam City Manager. I just want to call attention to the fact that at our City Council meeting tomorrow night, starting at 6 o'clock, and if you go to the City of Berkeley's website, you can access the agenda and the link.
Were you able to hear me at all?
Yes.
Okay, good. I think I was losing my my volume, my video here. Okay.
So if you go to the City of Berkeley's webpage and click on City Council, you can access the meeting agenda and the link to participate on Zoom or by phone. And we will be having a presentation on the city's homeless outreach during the COVID-19 pandemic. And so this is something we've talked about at all of our town halls, the work that the EOC and the city administration has done to assist vulnerable populations, particularly people experiencing homelessness. We will have a special presentation on the city's outreach and services to help people experiencing homelessness during COVID-19. So I encourage any Berkeley residents who are interested in learning more who would like to provide public comments to tune in and participate. So thank you. So we're now going to turn to your questions. So we received a number of questions from Berkeley residents over the past week, and some of them are relating to sort of operational issues, some very specific to a public health response, and then just some general questions. And want to turn our first set of questions to City Manager Williams Ridley. There was a question around enforcement of the face covering rule. And this particular resident, I'm assuming, frequently uses the Martin Luther King Middle School track and notes that there are individuals who are using the school track and not bringing masks, let alone wearing them, which puts sort of high-risk individuals at greater risk. And this resident was asking, can we put up signage, or could the city do some sort of targeted enforcement? So while this question was specific to one particular location, I guess it raises a broader question around sort of our sort of enforcement approach. So I don't know if there's anything you can share with us in response to that particular question.
So thank you, Mr. Mayor, and thank you to the constituent with the question. At this time, we certainly are trying to push harder on the actual need to really be very vigilant about wearing masks. Our focus has been on large group gatherings more so than smaller groups where you see people walking freely around the city. What we can do, and I will certainly take your information and make sure that our team that's addressing the zero mask wearing in our city is to take that issue and provide it to our code enforcement staff that are out there, just encouraging people to wear their masks, handing out masks when they do not have them with them. So the other thing that we can do, and absolutely we will look into putting up additional signage at that location and make sure that it's very visible for people to see and that they're aware of it. So I do thank the constituent for their time in submitting that question. We'll continue to do that. Again, our main focus is on large group gatherings and not so much individual folks that are walking the city without a mask. I will say that as I'm visiting the city and city resources and buildings and just going around and just looking at our city in terms of whether people are just wearing their masks, I will say that I'm very impressed. The people of Berkeley are actually wearing their masks. And it was really great to see the young people that I saw out and about over the weekend were wearing masks. So while I think we're doing a good job, we could always do a better job. So we'll definitely look at posting of additional signage. And we'll also have our neighborhood services code enforcement team just kind of take a look out there to see what's going on in that particular part. Thank you.
Thank you. The next question was around outdoor dining. So I think it was since June, our public health order has allowed outdoor dining. And many restaurants have taken over parking spaces to create parklets to allow expanded seating for outdoor dining. We are entering into the winter months, so we're expecting rain and colder temperatures. And so I think this question is asking, what is being planned to support restaurants that have opened dining outside, particularly given that we're entering the winter months and the potential that we may not allow indoor dining if we move to a different tier.
So thank you, Mr. Mayor. That is a great question. Our OED team, which is the Office of Economic Development, that team sits in the city manager's office. We've been working very closely with our business community to assist them in their transition to outdoor dining. So on our city's website, the city has a dedicated web page for resources just for our business community. And we have published an outdoor commerce and dining guide. This guide is extremely beneficial to our business community and provides a huge amount of information. However, with the fall upon us as winter rapidly approaching, our team is working with students at UC Berkeley, and we're developing a revised outdoor commerce and dining guide that will include best practices for outdoor commerce and dining in the winter. In terms of financial resources, our Office of Economic Development team received approximately $800,000 from the federal government to make low interest loans available to existing small businesses and nonprofits. And more details of this program will be coming soon as it's nearly finalized. So good news on horizon, but also I'm sure that as council and mayor, you may be looking at other areas to address our winter outdoor dining. And I'm sure the community will be interested in hearing more about that as we move down that path. But we do have $800,000 in terms of federal government resources to provide loans to our community, to our business community. So that's all that I have at this time, but I do encourage folks to go to our webpage and see what's being provided to our businesses around outdoor commerce and dining.
Following up on that, we are actually still raising money through the Berkeley Relief Fund, which is awesome. And we're actually hopefully going to do another round of fundraising around the holiday season, because I know a lot of people are making decisions on which different charitable organizations to give to. And we are in month 8 of the shelter-in-place order. While many businesses are operating, some in a limited capacity, they still need the support of the city to stay in business. We've sadly learned that a number of restaurants and other businesses have closed permanently and will not be reopening. And so, we are months from, when a vaccine is going to be available, and it's going to be some time before they can really fully ramp up their operations. So these next few months are really going to be critical, and we'll be talking with the city manager's office on how we can best make use of those additional monies in the Berkeley Relief Fund, perhaps to provide some financial assistance for businesses that want to buy heat lamps or to build out spaces to allow outdoor dining during the winter months. Those existing parklets transitioning so that they are able to operate during the winter months. So stay tuned for information about that and how the city can provide additional support for our businesses. But we hope by the next time we have our town hall to be able to launch the round 2 of the Berkeley Relief Fund fundraising drive, and hope that Berkeley residents will once again give generously to support our small businesses and arts nonprofits so we can get through the next 6 months. Thank you.
Thank you.
On another question on outdoor activity, this one on outdoor entertainment. This resident is asking, is the city going to allow outdoor arts performances? Can businesses seek permits? When will that process start? And this is something we talked about in prior virtual town hall meetings. At the present time, we're not allowing for outdoor music. Well, actually, we are allowing outdoor performances if they are permitted, but sort of incidental musical performances at businesses, we have not yet created a permitting path for that.
So I will certainly invite Dr. Hernandez to speak to this as well, but under Dr. Hernandez's leadership, we've been looking at and evaluating guidelines to allow outdoor entertainment, but this truly will continue and is a work in progress for us here at the city. We've heard from the community. We know that they are very interested in knowing about the need to move the needle on this. But at this time, the requirements that must be followed are the requirements that are currently in our health officer order. One of the most recent health officer orders allows for indoor live streaming, which was something that was previously limited to outdoor live streaming. So there has been progress in this area, not so much as I'm sure that folks would love. I'm sure people would love to see it completely open, but currently the current orders stand at this time. And Dr. Hernandez, I don't know if you'd like to provide more information around outdoor entertainment.
Madam City Manager, pretty much you wrapped it up and said it very well. We are looking at ways that we will be able to do that. The state hasn't provided formal guidance. They've given some information in a FAQ format, but they haven't released any guidance yet. However, we are working with that information to try to have a path forward for additional activities. That said, I'm worried about, at this point, the only thing that we've allowed additionally in the last order was schools. So we'll still work to get a path forward, but at this point, it's not included in our current order.
Thank you very much. There's a question around vaccines. As we learned, Eli Lilly announced that as a result of the clinical trials, they announced a vaccine that has a 90% protection rate from contracting COVID-19. And so there are a lot of questions about when that vaccine will be made available and how it will be distributed throughout the country and throughout the world. And so this question, which is a timely and important question, is assuming that we are ready for mass distribution spring, what efforts will the city take to help distribute a vaccine to our community? So Dr. Hernandez, I don't know if there's been any information that's been shared with health officers around sort of statewide plans on vaccine distribution, if it's going to be done through healthcare providers, through county governments, city governments. There's any sort of information you can share? I know we're kind of at the early stages of the kind of planning, because I don't know if we have a date yet when that vaccine is going to be widely distributed. I know that they're allowing it for sort of emergency use, limited emergency use, but any information that you can share at this time around vaccine distribution.
Yes, so Mr. Mayor, I definitely, this is a question for Dr. Hernandez and or Dr. Varhus, but we have certainly been starting to develop the infrastructure to support future distribution needs. That it will be a lot of work and a heavy lift for our public health and staff and Dr. Hernandez, but we are well underway with developing the infrastructure to support any future distribution across our city. So I'm sure Dr. Hernandez and Dr. Varhus may be able to provide more details about timing and different things. So I'll hand it over to you.
Sure. I'll just add to what you mentioned, Madam City Manager, which we've been planning for vaccine distribution of any sort for a pandemic for years. It's how we structure our flu pods and how we distribute flu vaccine every year. So that's the good news. And we've done it in the past for new vaccines when we had H1N1 vaccine distribution, when we did vaccination of the community for pertussis, the whooping cough vaccine that was distributed through public health. So we've done this before. What has changed now is that it's going to be a larger scale. And exactly as you mentioned, Mr. Mayor, we have been planning this for a while. We have had conversations already specifically about the distribution of COVID vaccine within the state. Not only myself, but additional staff from the EOC have been part of it. We have a specific unit that is working on vaccine distribution, some of which are the staff that participate in our flu pods and our flu vaccination. But it's a big process. And not only are we working internally, we're working with our healthcare partners within the city and our county and then the state. So we have plans starting to solidify some of the plans, working with the state in terms of how that would look for distribution. The local health jurisdictions will hold some of that, but also it will also be a partnership with healthcare providers and potentially pharmacies and throughout the state. So it's a big process. Fortunately, we have plans that we've used before on a lower scale with, as I mentioned, H1N1 flu and with pertussis and our annual flu. So we're in a good position and we will continue to build on that.
Okay, thank you very much. Now moving to some questions for Dr. Hernandez. Kind of going to group these first two questions because they relate to Cal football. So I think it'd be good to maybe kind of update the Berkeley community about, what went into the decision to not let UC Berkeley play this past weekend. Maybe talk about the protocols that UC Berkeley has implemented. And then I guess a specific question was, assuming there aren't any more positive cases, when can they play again? I don't know whether you're in a position to answer that or whether that's a question for UC Berkeley, but I think it'd be good to maybe shed some light on, what led to the circumstances under which UC Berkeley did not play this weekend.
Sure. First, I want to start with saying that UC Berkeley has been a great partner, continues to be a great partner. We've worked with them prior to the pandemic for other medical and public health concerns, and we built up on that response to continue to our partnership. They have excellent plans for the whole institution, and that includes their plans for their student athletes and for athletics. Their plans are excellent, but no plan is perfect. No person is perfect. So there is always going to be a possibility that there's going to be a case. And with cases are contacts. So I just want to first say that excellent partner, excellent plans, and nothing is perfect. There's no blaming or pointing of fingers from the city of Berkeley side anyway. And I know that Cal is doing a great job, and they will continue to do a great job to protect not only their student athletes and their staff, but the community. So I just want to say that. So what happened is that there was a positive case in their football program. And as usual, a case investigation was performed with that case. And with that, then identified contacts were also identified. So we had a case and then associated close contacts. And as per protocol from City of Berkeley, from state, from CDC, those people that the case has to be isolated and the contacts have to be quarantined. And that's what's happening. And unfortunately, because Cal did not meet certain requirements of NCAA, they had to cancel the game. So it was not a cancellation that was done by City of Berkeley or myself. It was due to whatever requirements the team had to meet in order to play. So that they're two different things, and they're related because it did impact their roster for game day. But it was not a requirement that the game was canceled because of the number of cases or what have you. So I just wanted to mention that. The good news is that the individual who is a case is recovering, is doing well. So I want to make sure that we also highlight that fortunately this individual is doing well and seems to have recovered or is recovering. So that's always something that I take into consideration foremost. And I want to say that it's student safety and health and the individual safety and health. In terms of returning to play, again, that's going to be a Cal decision based on their roster. I'm hopeful that the case will be able to return or be released from isolation. I'm not sure about those quarantined. There's a good chance that those people in quarantine will not be released because of the requirements by the state. If you look at their industry guidance on page 31, it basically, you have to adhere to the standards that are set across the board for everyone who is in isolation, which is 14 days from last exposure of that contact. So at this point, I'm not sure what the roster looks like for Cal, but those individuals that are quarantined most likely will not be released from quarantine before game day.
Okay, thank you very much. There was a question about contact tracing. I'm assuming that this resident looked at the maps on the Alameda County website where they track sort of case rates by zip code. And this question is asking why there appears to be a positivity rate in the 94710 zip code that's much higher than the rest of the city. I guess that positivity rate is 2.4% versus 1.06%. I don't know if you have any insight as to the reason why there may be that discrepancy. I will note that looking at the dashboard on the city's website, that Latinos and African Americans have higher rates of COVID-19 in the city of Berkeley than other ethnic groups, and that's the case throughout the state of California as well.
And unfortunately, throughout the nation. If folks interested in public health go to the city's website, you will see our health impact report of 2018. I wasn't here then, but Dr. Hernandez contributed quite a bit to that. And it really shows where we've been able to impact our city's health in a positive way. And it also shows what our challenges are. And what you can see that Berkeley is not anywhere different, unfortunately, than many other cities in this country, where we actually do see health disparities that are based on race and also place. So we know, and we have known, that people who live, African Americans who live in West Berkeley have more health challenges than white counterparts who live in Northeast Berkeley. And that is an unfortunate, a result of a history of racism and less access to health services, education services, and other things that we're all fighting so hard for in Berkeley. And I know you, Mr. Mayor, are fighting hard for it in Berkeley. And so we really need to take a targeted, supportive, equity approach in all of our health issues in supporting all of the people in Berkeley. And I will say that we are doing that in our COVID-19 work. So some of the things that we're taking explicitly to address health disparities in Berkeley in COVID-19 is that we've implemented a targeted equity testing strategy where we're bringing testing out to communities of color to increase testing rates. We've been working with some local nonprofits to help provide more of an informational campaign in English and Spanish, and actually are intending to do much more of that with some new grant funding that we recently received. We have been providing resources for people who are isolating because of COVID-19 and families that may have to quarantine. We've actually provided 100% of our families who've needed some kind of resources to be able to to quarantine and isolate, to make sure they had food, to make sure that they, were able to care for themselves. And we're going to be continuing to explore the data very, very carefully through that equity lens, because that is the place where we can really make a difference in our broader community over the long term. So that is the reality of the situation. I will also make sure to say that that test positivity rate, while it is higher, 2.4% is higher, it is still not as large as it is as we see it in other places, for example, in Alameda County, areas where they have sort of higher density population rates. It is still low when you look at the average across our region, but it is not okay that we have this disparity, and we need to continue to fight so that we can bring a health equity to Berkeley with regards to COVID-19.
Thank you. There was a couple of questions around contact tracing. So I guess I'm just going to kind of combine the questions, and there were questions around how effective have we been at contact tracing. Indicator target's 90%, but we seem to be at 80 to 85%. Do we have too few contact tracers? Are we looking for volunteers to contact trace? One resident is a retired MD and expressed interest in volunteering to assist the city. So Dr. Hernandez, could talk a little bit about our contact tracing efforts. And I know our indicators set a certain goal. We're not fully at that goal yet. And are we, is the city open to, volunteers with some medical experience assisting the city in its contact tracing efforts?
I'm trying to think of a funny but honest way of saying it. I'll take all the help that we, if there's people that want to offer help, that there is still a way to volunteer on our webpage. It's the last bullet under health officer orders. It's on the COVID webpage, especially for clinical support. But quite honestly, we have adequate supply of case interviewers and contact tracers. But as we see the case rates climb, we never know what we're going to see. So I never turn down an offer for a volunteer to put their name in the hat. And if we need to pull out the name, then we have more options there. So I would say that at this point, we have adequate staff to respond. However, this is a pandemic, and you just never know how things are going to change. So I want to thank that individual for the offer and say, just go to the website and it's there. It's the last bullet under the health officer order bullet section, which is the first section. In terms of why does it seem like we're not making that 90% target? Again, it's not due to the lack of staff. It's again, hesitancy of individuals from answering their phone or providing information that we need. And also some individuals are not able to isolate or quarantine effectively because they live in a multi-generational household. So they are sharing rooms, they're sharing space, so they're not able to quarantine. So that's what we're seeing at this point. So again, thanks for the offer. I do think it's a great thing to hear that our community continues even in month 8 or 9, that they still want to help out, and that's amazing. I didn't know if there was another part of your question, Mr. Mayor, that I missed.
No, I think you answered both of them completely. Thank you. There was a question around guidelines. Which guidelines are we following? The CDC or WHO guidelines? Do they differ? Are they adequate given recent surges in the US and Europe? What can we do locally to get close to what South Korea is doing? So I know we can't close our borders like New Zealand.
No, we can't close our borders like New Zealand, nor can we track people as closely as South Korea is doing in terms of looking at credit cards and where people are moving that way. So I'll answer the first part of the question first, which is like, what guidelines do we use? We use CDC's guidelines for quarantine and case definition. I didn't see much of a difference between CDC and WHO. However, we are using CDC's guidelines, and then of course the state's guidelines that complement that. So that's what we're using for case definition and for definition for what a close contact is. Other things that are around that have been used throughout the nation, and they're piloting actually here in the state of California, is something called, oh gosh, I thought I had it memorized, but I don't remember that. It's called COVID, I think it's called COVID Now, COVID Notify, which is a way to opt in with your iPhone or with your smartphone to notify individuals that have also opted in that they might be a close contact. So let's say I'm a case and I've opted into COVID Notify, then I would be able to contact anyone that was considered a close contact who has also opted in their smartphone. So that's a pilot program that's happening throughout the state. The state might be expanding it, but right now it's at University of California campuses. Cal is actually going to participate in that later this month. So that's something it's not exactly having the government or anyone looking at your ATM withdrawals or your credit cards or any of those tracking, but this is opting in to be able to notify individuals that would be considered close contacts. It's not a perfect system, but it does allow individuals to be notified that we may not necessarily identify because an individual does not want to provide that information or does not know that information. So that's the closest thing that we are getting to here in the United States that I know of that's actually being utilized, and that's also being piloted throughout the state.
Okay, thank you very much. There was a kind of question and comment about indoor dining. Why are we allowing indoor dining? This commenter talked about the risks of indoor dining and was encouraging the city to reconsider and ban indoor dining until the COVID situation is much better. You had talked about earlier on in your sort of opening remarks about, I think tomorrow the state's going to announce with the status of the tiers in the state of California, and there's a potential that Alameda County may move backwards into a different tier soon. Would that impact allowing limited indoor dining?
At this point, so every week the state releases their tier status, and it's at this point I don't anticipate Alameda moving back into a more restrictive tier, though the case rates that we're seeing are definitely worrisome. If we happen to move back to the next tier, whether it's this week or the week coming, that's would be the red tier. And we're actually sitting at the red tier when it comes to indoor dining. So we haven't expanded our dining or some of our other indoor activities to the orange tier status, which is the tier that we're in. So it wouldn't change much of the activities that we're actually allowing within the city or the county jurisdiction if we moved back to the orange tier, especially in terms of indoor dining. Again, it is definitely worrisome because we know that that's where it's one of our riskier behaviors. There's data. So I understand the individual who wrote in that question, their concern about the risk. But at this point, we are still in orange tier, and even if we move back to red tier, it wouldn't change at least from the state's perspective, are restrictions in terms of indoor dining.
Thank you.
Mhm.
There was a question about schools opening in January when the recent health order allows them to open in November, while the health order does allow elementary and middle schools to begin limited in-person instruction and have those schools begin planning to reopen. The decision on whether BUSD opens is a decision of the school board and the school district administration. I know that we've been working very closely with BUSD and they're planning for reopening. I think, haven't they allowed some limited, Dr. Varhus, some small pods of kids to begin, coming back? I was actually in line to get tested at the curative site. This was last week, and I ran into a teacher who said that they're getting tested in anticipation of potentially coming back.
Yes, so I believe they started a smaller pilot at a select number of elementary schools this week. What I'll say is that BUSD is working really hard to get everything in place so that all of their staff and parents and students can feel as safe as possible as schools reopen. And just by nature of their school design and whatnot, it's taking a little bit of time to do so because they don't want to be stepping one step forward, two step back. As of today, actually, all preschools through grade 12 can open under the state guidelines and the restrictions set the health officer. And we do have some private schools that have been operating. And so we, are hopeful that things will go well in the school district and elsewhere so that we can get kids back in school. I'll also add that Dr. Hernandez talked about each school needing 2 COVID liaisons. We actually have developed a learning community among all of our school population that is meeting regularly to really discuss all of the, both to provide training, but then also to discuss any challenges that schools may be running across. And we intend to operate that learning community and help support all of our schools as they move forward and throughout, the foreseeable future, as long as they need it. And in addition to that, on November 17th, we're going to kick off a second learning community, which is going to be for early child care providers. They face some similar issues, but some slightly different issues. And so we'll be cohorting them together. So the city is going to continue to offer ongoing support for all of our schools because we really want to get our kids in schools. And I know parents want to get their kids in schools and we want to do it as safely as possible.
Thank you very much. There was a last question around the curative pilot site. This resident is asking if the curative site is still open. I was there last week and it was open at the adult school. You are encouraged to make an appointment. And if you go through the City of Berkeley's website, cityofberkeley.info/COVID-19, there's a link where you can go and actually make an appointment, although they do allow some walk-up slots as well. But you are encouraged to make an appointment online, and the results are usually available within 24 to 48 hours. I got mine in 24 hours. And there was a question around the false negative rate for this test compared to the Abbott rapid test used at another Oakland site. I don't know the answer to that question. I don't know if.
Well, perhaps Dr. Hernandez can answer about the rapid test, but the curative test is not a rapid test. Yeah. It's not one of those that you get back within 15 minutes, which are more of a screening, less reliable tool. For example, had been used previously at the White House. It's not a perfect tool. The curative test and the Optum test are both testing task force approved methodologies that are much more certain. So if you received a positive Abbott test, you would want to confirm that through a much stronger test, which would be like the Optum or curative test. I don't know, Dr. Hernandez, if you want to add in any of that or correct any of that if I missed it.
Well, I would say that if uh, the the rapid test, as you mentioned, is not the same test as the PCR test that we're having, that is being offered at Curative, as well as the opt-in site, and is pretty much some of the ones that you would see at other healthcare providers. The Abbott test is an antigen test or an antibody test, most likely an antigen test, and their false positive rate is not bad. So if it's positive, it's positive. You definitely could confirm with PCR. The trickiness about that test is when you're asymptomatic. When you don't have symptoms, it's not as sensitive, and that's where you do get worried. So if you're symptomatic and it's positive, it's definitely positive. But if you're symptomatic and it's negative, you definitely want to follow up with getting a PCR test, and remain isolated until you get that confirmatory test or speak to a healthcare provider to decide what to do. So best test right now is the PCR test. We are hoping that all the technologies are getting improved, not only with different types of tests, but also how the tests are administered. I know everyone's tired of getting swabbed in the nose, so hopefully we could use saliva one day, or that we could use other methodologies, but more and more we're going to see different options be strong options for the community, whether you're symptomatic or not. So more to come, but hopefully that answers the question.
Yes, once again, if you'd like to sign up for a test through Curative, go to the city's website, cityofberkeley.info/COVID-19. We have the walk-up test site still open at the parking lot of the Berkeley Adult School at San Pablo in Virginia. And it's quick, it's painless, and you much more comfortable than the nasal swab test. And you get results within 24 to 48 hours. So that testing site is still open and available for Berkeley residents. There was a question around planning for the holidays, but I think Dr. Jimenez, you addressed that in your initial comments. And then there was a question around the impact of ongoing restrictions in terms of broader public health. And there's no doubt that the shelter-in-place order has had an impact on our economic health. You know, some businesses have closed, some have more restricted operations, some aren't open, and it certainly had an impact on mental health as well. Not just people sheltering in place, but people who've been impacted by the COVID-19 pandemic, either losing family members or losing their jobs. And so there's no doubt that the impact of this pandemic is felt on, in many ways, economically, in terms of public health, mental health, but the steps that we've taken and other health officers and state and federal governments have taken to control the spread of COVID-19 is to protect the public health of the community and make sure that more people aren't dying due to this virus. And so there does come at a cost. There's no doubt. And this has been a very challenging time for our community. But the fact that we have been able to control the spread of this virus better than many other communities in California is a testament to the early steps that we took and the ongoing work that we're doing to combat COVID-19. I don't know, Dr. Hernandez, anything else you wanted to add on that question? I think we got a similar question at a prior town hall meeting, and it's worth noting that while we're doing this to protect public health, it does have a real toll on our community in many, many ways. Okay, thank you. So I'm going to address the last set of questions, which is the first question: when can our city commissions resume their schedules, since meetings can be conducted through video and teleconference? That should enable broader participation. The city manager has been working to allow commissions to meet around important important time-sensitive business. Many commissions have already met this over the past 6 months, and in fact, all commissions, I believe, are going to be meeting over the next sometime in the next 2 months to develop work plans for next year. Madam City Manager, is there anything else you want to add about the sort of the plans for phasing in commissions?
So yes, Mr. Mayor, as and equally important to you and to me and the staff here at the city, in terms of the amazing support that our commissions provide to our city and the work that gets done here. We're going to continue with the discussion around how we move forward with, greater amounts of our commissions to start online, with the expectation that sometime next year we have them all fully back online again. That may take us some time, depending on how we evolve through COVID, what our biggest and next challenge is, and hoping that there's no new emergency that arises for us as a city. But I think there is a meeting coming up where we'll be presenting to the Agenda and Rules Committee, and it, just an assessment that our staff and I have done to kind of look at what commissions can open up that have not been allowed to open, that we think we have the resources and capacity to do so as we're shifting our resources around for this COVID pandemic. So there'll be more movement coming, but not a total amount of movement, but we are going to see more movement around some of our commissions that have not met. They will also be allowed to meet. So more to come on that. We'll have a conversation, I believe, at the Agenda and Rules Committee scheduled for this week, I believe. Thank you.
Thank you. There was a question about how I feel about the new federal administration in helping address the pandemic. Will there be a demonstrative difference? Will we feel the impact immediately? As I noted in my introductory comments, the incoming Biden-Harris administration is already working to develop a national plan to address the COVID-19 pandemic, and their hope is to launch their plan on day one. I think key to this is many things, but key is getting a new CARES Act through the Congress. And my hope is sometime before the new administration takes office that there will be a compromise reached between congressional Democrats and Republican leaders to move a CARES Act bill forward. But certainly that's a priority of the new administration. Definitely, controlling the spread of COVID-19, being prepared for the mass distribution of vaccines, expanding access to testing and contact tracing and personal protective equipment. All those are priorities of the new administration. My hope is that we will see, increased funding and partnership with state and local governments in addressing this public health crisis. There was a question around what % of Berkeley's residents are employed by small businesses and how have Berkeley's small businesses been affected by COVID-19. I don't know, Madam City Manager, if we have actual numbers on economic losses or on numbers of businesses that have closed. We have approximately 5,000 small businesses in Berkeley, and when we launched the Berkeley Relief Fund in March, as part of the Berkeley Relief Fund, we provided 1.7 million emergency grants to 700 small businesses. As was noted 2 weeks ago, we approved a COVID-19 resiliency loan program that's part of the city's revolving loan fund. That's partially financed by the prior CARES Act, and that's an emergency loan program for small businesses that have been impacted by the COVID-19 pandemic. Our Office of Economic Development is working closely with the business community in adapting to COVID-19, including advice on how to safely and effectively reopen, including allowing outdoor activity. I don't know if we have any official statistics on economic losses. I know that we have projected actuals and projected tax losses that in like sales tax and transient occupancy tax that our finance department has calculated and projected. But I don't know if we have numbers on actual businesses that have closed. Every day we read in Berkeley side about one business that closes or another that closes.
So we don't have that information tonight, Mr. Mayor, but I certainly think it would be a good thing to come back with that at our next town hall and provide that to you. And yes, we are closely monitoring our revenues from our sales tax as well as our TOT, which is transient occupancy tax. Those are the areas where we're monitoring very closely on our revenues. And at our upcoming Budget and Finance Committee meeting, policy meeting this Thursday, we'll also have information about our revenues and our plans for how we close the year to discuss with the policy committee. So I would encourage folks to tune into that if they're interested in hearing more about different presentations from our departments, as well as how we close the year and our revenues and the projections of those. Thank you.
Yeah, my recollection, there was a pretty significant drop in hotel tax revenue in the last 6 months of fiscal 20. And we saw a pretty big, a noticeable decrease in sales tax revenue. We are, I think the projections weren't as, my recollection in reading the finance director's report was that they weren't as bad as catastrophic as we thought they would be, but needless to say, it was a hit.
Right, and at this time, we don't have anything in the work. We only have one quarter to work off of. So we've got to wait for those to come in to see our trends and what that looks like. So I don't want to be too premature, and I don't want you to, I just want to say that we're still going to monitor it, but we have to wait for just kind of like a trend to see at least 2 quarters to kind of help guide us a little bit more.
Yeah. So no doubt that the COVID-19 has had a real negative impact on our business community. Sadly, some businesses have closed, but we're really fortunate that many businesses are still in operation and are continuing to stay in business, employing people in our community. And so our focus is how do we support those businesses to make sure that they stay open and get through this pandemic. There was a question around tenants, and I'm assuming residential tenants, and asking the city, what is the city going to do to support tenants during this pandemic and after? We've done a lot over the past 8 months to support residential and commercial tenants who have been affected by the COVID-19 pandemic. The first day the shelter-in-place order went into effect, we adopted a moratorium on residential and commercial evictions, and we have strengthened that policy in the intervening months. We launched we strengthened our housing retention program. We put, I think, probably close to $2 million into that program to provide emergency grants to people who are facing eviction and housing insecurity, so that they can pay their rent and address the growing rent debt that they face. There is no question that in the coming months, we need to lobby for stronger legislation at the statewide level, because the eviction moratorium that was passed by the legislature and signed by the governor actually ends on February 1st. And so we need to have something in place after February 1st. And we also need to think about how we are going to support residential tenants and small property owners who are either unable to pay their rent or have seen a significant loss of rental income. And what happens after this pandemic when people have thousands and thousands of dollars of unpaid rent that they're going to have to pay. So these are some critical issues that we will be working on in the coming weeks and months, so that we can help protect people from eviction and homelessness, and to work to keep people stably housed. We know this is critical to also controlling the spread of COVID-19, but we have taken steps, and we will continue to take further action to protect our residents and to prevent homelessness. So those were all the questions that we had tonight. And I want to thank our panelists for joining us this evening, taking time out of your very busy schedules to update the Berkeley community and to answer residents' questions. We will announce the day of the next town hall meeting and invite an opportunity for questions. So please stay tuned for information. But in closing, I just want to say, I want to thank the Berkeley community for really making this issue a serious priority. I am encouraged by the number of people I see wearing face coverings outside. I'm encouraged by the fact that people are practicing physical distancing, working to take this very seriously. It's certainly been challenging for our community, but we must continue to stay vigilant, particularly as we're entering these winter months when we have the twindemic of flu and COVID-19, where we're even at greater risk. It's been 8 months, but we can't stop now. We have to continue to take this very seriously in order to control the spread of this virus, in order to get our community through this crisis. So I want to thank the Berkeley community and ask that we stay vigilant, particularly as we are entering the holiday season. And we may be deciding whether to visit family members or having family members visit us. It's important that we follow the guidance that's been issued around how to safely celebrate the holiday season, and we'll be working to get that information out to the Berkeley community in the coming weeks. So before we close, I want to give each of our panelists an opportunity to say some final comments to the Berkeley community. So I'll go to Dr. Hernandez, and Dr. Hernandez, do you have any parting thoughts for the Berkeley community tonight?
Mr. Mayor, I want to echo your words of both thanks and caution. One is thank the community for remaining true to the health order guidance and requirements with wearing face coverings. I know this is tough. There's a notable fatigue with having to adhere to these guidelines. And word of caution is that, as mentioned, it's a holiday season coming upon us, so we have to be even more cautious as we celebrate the holidays this year, because, as you mentioned, it is flu season. It's also a time when we're less likely to be outdoors, and that increases our risk. And then I would say I am hopeful because of and I try not to be political, but the change in leadership in Washington, D.C. Is definitely one of hope, and also one of hope for the pandemic response, and also for women and women of color, because of the leadership in the White House that I will say I'm very pleased to see. It's really good, a good time for our community to have some of those signs of hope. So I'll end it there, and thank you again for having this opportunity to speak to the community of Berkeley.
Thank you. Dr. Varhus, any final thoughts to share with the Berkeley community this evening?
Yeah, I just want to echo my fellow panelists' sentiments. Thank you, Mr. Mayor, for hosting this event. Thank you for having us. This is Thanksgiving month, and I know that a lot of us have been really, we've all been dealing with the low to medium grade depression of our losses this year. It's been a very challenging year. There's not one single individual that hasn't been impacted, and some have been impacted more than others. So I just really want to encourage us to really use this month of Thanksgiving to be thankful for what we have, to be as gracious and kind with each other. And the more we can stick together and stay positive, the better that we will get through this. A new day will come.
Thank you so much. Madam City Manager, any closing comments for the Berkeley community tonight?
Thank you, Mr. Mayor, again, and congratulations to you. I echo the sentiments of the entire panel this evening. I think one of the things, as an African-American woman, I was just sitting here and listening to everyone. Look at the diversity on this panel. The diversity on this panel is amazing. And the amount of trust that the community has put into all of us to lead and to work hard for them. This is your leadership. And I believe that all of us on this panel are doing our very best for the Berkeley community, and I'm very grateful and very proud. And I will take that in with me, Dr. Varhus, for this Thanksgiving season, to be thankful for what we have. And I'm looking at a wonderfully diverse and very, very intelligent panel. And I think I'm thankful for that. I'm thankful for all of you, definitely my staff, and of course the mayor. I'm thankful for the fact that we get to lead our city once again together. And I'm very proud of the work that we've done with our staff and with the community. So thank you all, and thank the Berkeley community for joining in on the call this evening.
Thank you. With those final comments, I just say that, I'm incredibly thankful and honored to be able to live in this community and represent this community. I'm really honored by how serious we've taken this public health crisis and how we have looked out for each other. And it has had an impact, and we must continue to do it over these coming weeks. And I'm really honored to be part of an organization that has such incredible leadership. Our public health officer, who has worked tirelessly this entire year to protect our community. And there's no question that you have saved lives. To our city manager, and to the director of the Department of Health, Housing, and Community Services, and all of our city staff. We're so fortunate to have such dedicated, excellent leadership at the helm, guiding us through this crisis and many other crises simultaneously. And it is having an impact. And my one request to the Berkeley community is, as we celebrate this holiday season, let's be careful, let's be cautious, but let's be thankful. So with that, thank you everyone for joining us tonight, and please be safe, and see you at our next town hall meeting.